Hello everyone, I am Dr. Sunil Patil. I am consultant urologist and andrologist at Athayo Urocare Center, Thane. Today I am going to give a brief introduction about VIU surgery, which is also called OIU. So this surgery is done for urethral stricture disease in male patients. What is urethral stricture? It is usually called narrowing of the urinary tract called urethra at one place or multiple places or throughout the urethra. Urethra is a tube which connects the bladder, urinary bladder, and which helps in carrying the urine from urinary bladder to the outside. So this urinary tract called urethra, which may get narrowed due to multiple reasons. It may be short segment or long segment. If the stricture length is a very short segment stricture, less than 2 cm, then it may be treated with minimally invasive treatment called VIU, which is an endoscopic procedure. Endoscopic means we insert a scope from the urethral opening from where we pass urine. The scope is inserted and it goes up to the site of the stricture. The stricture segment is inspected, and after that a VIU assembly is inserted again through the urethral opening, and it goes up to the stricture segment, and the stricture segment is opened up wide so that it admits the VIU assembly very easily, and then it goes up into the urinary bladder, after which the urinary bladder is also inspected for any abnormalities. After the procedure is completed, we usually keep a Foley's catheter for up to 5 days. The patient usually is discharged the next day. Patient usually does not have any pain post-operatively and may not require any analgesia requirement or painkiller requirement post-operatively. After the procedure, the next day the patient is discharged and usually called on day 5 for the Foley's catheter removal. So this procedure is minimally invasive, but it has some limitations. For a short segment stricture, the success rate of the procedure is only 20 to 30%. As in, only 20 to 30% patients are getting cured permanently. In the rest of the patients, the stricture is going to come back again, usually in a few months, or it may come back after 1 or 2 years also. If the stricture comes back again, then the definitive procedure for such patients is urethroplasty, which we are going to discuss later on. If the patient has a long segment stricture, or if the patient has stricture in the distal part, that is the penile part of the urethra, in those patients this procedure is not suitable and they are usually done with urethroplasty procedure. Thank you.